I am Paige Hale, and this is my story. I fell into nursing accidentally, loved it, loved the clinicals, loved going to school at Ohio State, loved everything about it, but didn't know why it was picked. And then once I got out and had graduated, that's when I knew that it was meant to be. My little brother was in a huge accident, and he was in adult ICU for many, many weeks. And that's when I actually learned what nursing meant. You can learn from books, but once you get your first real experience, you're kind of hooked. I was ready to graduate in my last semester of college, not knowing what I wanted to do, where to line up interviews, and when he got hurt, he was in a major car accident. He was a traumatic brain injury. He had broken almost every one of his vertebrae, and we knew we were going to be in the hospital for a long time. I didn't know how to be a nurse. All I knew is that I was getting this degree. And I learned more in those 6-7 weeks that he was in the ICU than I did probably my whole time in college. And then that's how I kind of transitioned from getting a degree to getting a career, and became an ICU nurse. I didn't want to do adults because of what I saw in the adult ICU. Their bodies are just too big, their hospitals are kind of institutionalized, white walls, nothing fun. So I took the ICU that I learned from those nurses, the medicine, and kind of transitioned into pediatric ICU. I spent many months learning how to be a pediatric ICU nurse, and my first patient happened to be really sick, and we had to have a conference, excuse me, family care conference to tell the parents how sick she was. And I had never been in a conference like that before. And so I kind of had to take the nursing angle and talk about why she was getting so sick, and that her disease was progressive and we knew it was coming. And sorry, the mom said, we're gonna have this meeting right here in the patient's room. And I got anxious because I didn't want the patient to hear what we were saying, but I also didn't want mom to be more uncomfortable having this chat. So we had the meeting in the room, and of course I started crying. It's my first day off orientation, and they're trying to tell me that this patient is going to die. So I'm crying, trying to stay professional, trying to keep doing my job because we're in the ICU, and the meeting's going over an hour, and I have to do my hourly cares. So I kind of bent over my patient with my stethoscope, did my assessment, and I'm still kind of choking back tears and probably snot. And the mom was laying in bed with her and said, if you drop tears on my baby, I'm gonna lose it. And I just looked at her and she goes, I'm just kidding, I've been crying on her all day. And she said, it really means a lot to me that you're this emotionally attached to my baby. I know that you're gonna keep her safe, and she's still alive and she's doing great, and that family and I are still very close. So that was my first day off orientation, and all day I thought, I'm quitting, I'm getting a new job, I'm not doing this, I'm not cut out for it. And ever since, now I love that patient, I love her diagnosis, I love pediatric ICU, and it really kind of changed by the end of the shift. I was hooked.